with us today, and it is my pleasure to
Good morning, everyone. And kind of compare the back in last time we met, 83 active COVID-19 cases. Today we have 8,088 cases. We had 181 individuals that were in the hospital. Today we have 368 individuals in the hospital. We had 7 in ICU. We have 101 in ICU today. We had hospitalization rate, which was up from really October, September, and August, which were under 4%. Today we're at, back then, which again we talked about, and that's why we had this meeting, that it was a little bit high and it was at 9.71. Today we're at 18.28. So these are numbers that go back by weeks. 11/11, 9.1, 11/15, 11.19, 11/22, which is right prior to Thanksgiving, we were at 13.28, and after Thanksgiving, 11/29, we were at 7. Now the shopping season's up here upon us, and we're at 18.28. So these are numbers. So I'm not trying to be an alarmist, to be honest with you. I just want to show the numbers we are today, because if we look at where we were a year ago, we were way off, way back. You know, a year ago we were the worst city in the nation. And this is why we want to talk about the numbers where we are today, so we can make sure that we do the proper and precaution. Now, and we also, you know, there's the Omicron variant, which we know very little about. On Monday, the first case was reported in Houston, and we really know very little about. So it's really important that we continue to use face masks, we continue to social distance, and we continue to know our surroundings. So these numbers are very sobering, but I don't want people to be alarmed by the numbers. We just want to talk about what do we need to do moving forward. Now, the breakthrough cases and the cases that people that have been fully vaccinated. Now, this does not include the booster shot. We have not really had enough information to talk about the booster shot. So this is people that have had 2 vaccines for the most part, and we have no data, including the booster shot. Out of the 4,069 COVID-19 cases last week, 1,443 were fully vaccinated citizens of Paso. Now, we're at 5 years and up, we're at 71.2%. And when you look at, let me get my chart from back here. So we're now starting to calculate it. Remember, before when we were talking about it, it'd be 15 and over. So now we're talking about 5 and up. And they're great numbers. And that's what really we want to continue to talk about, the vaccination, how we continue to get vaccinated. And that's why we're not as bad as we were. That's how we've overcome a lot of the things that have happened today. So if you look at 5 years and up, fully vaccinated, we're at 71.2. The state of Texas is at 54%. 87% of our citizens, which is a huge number, 87% of our citizens 5 years and up is partially vaccinated, where the state's only at 62%. The number that we focused on originally, and we've talked about this many of times, was the most vulnerable part of our population, which was 65 and up. And that part of the population, fully vaccinated, is 92.3%, and partially vaccinated is 99.9%. So basically, we've really reached the people that needed to be vaccinated. We've kind of talked about the COVID rate, 166 cumulative cases and 826 new cases here recently. So I just want to, like I said, I don't want to be an alarmist, and this is not what we're here about. We're here to talk about real numbers. We're here to talk about that we're doing very good compared to last year, but we can't let our guard down. We have to know our surroundings. We need to know that right now we want to enjoy the holiday season. We want to enjoy our friends and our family. And how do we do that? First of all, continue to get vaccinated. Number 2, understand your surroundings. Number 3, wear a face mask. Number 4, social distance. And always make sure you sanitize your hands. And we continue to do that. We'll enjoy the holiday season coming up. We have, the next 3 weeks will depend on us as citizens of the city of El Paso, whether we do the right thing and continue to stay protected, because the next 3 weeks will be very challenging. Omicron's virus we know very little about, and we do have the holiday season, the shopping, our border, and our friends from across the border are coming across, and you do know that the only way they can come across is are fully vaccinated, and we'll continue to do that to protect our citizens of El Paso. So we've expanded our hours for our testing sites, and we'll continue to provide the vaccine for anyone 5 years and up at no cost to anybody. So again, I urge you to know your surroundings and have a very happy and prosperous new year. But again, we can only do that if we, as citizens of the city of El Paso, continue to protect ourselves, our friends, and our loved ones. Thank you, and I appreciate everybody being here, and may God bless everyone. And now I have the great pleasure of introducing my good friend and we actually have continued to speak with one voice. We've actually continued to inform the community and be on the same team, and that makes a difference. You don't have to decide what's right or wrong, because we have the same word, we have the same vision, and the vision is that one more life lost is one too many. So thank you, Judge.
Thank you. Thank you, Mayor. And but it is a call to action. And I think we've done this before. We've been here before. As a matter of fact, actually a year ago. So we know that we have 26 positive cases, and we also know we're part of a very vulnerable community. Compare us to other communities because we are so unique. We know we're vulnerable. We have one of the highest in the country, and so that as much as that's good, and that we're close, it also creates some challenges for us. We know that we are hospitalization, and that's the outcome of our community and how we live, which is extremely careful about that. We all know we're very conscientious about the business, and we're very conscientious about making sure that we move forward, but that it doesn't hurt our economy. Be used because we didn't have the vaccine and we didn't have other ways to approach that. So yesterday, I had the opportunity to be part of a roundtable of a business community. We had individuals like James now, and which will help tremendously, of the Texas Restaurant Association, and also quite a daughter, Vanessa Duran, here in El Paso. We had the Restaurant Association, the LULAC, Hispanic Chamber, and the El Paso Chamber. We also had individuals such as Joe Lopez from the marketing group, which is going to put together on a pro bono basis, put together a strategic plan for us to communicate. The mayor and I know, and we're very conscientious, that we need to communicate, and we need to communicate rapidly so we could do what we need to do. We also have, commitment from others like Horizon and Simon Properties, who, as you recall from the last time, were very active in trying to help us and do things and set examples in the malls that would help us show that we need to take this into effect. So let me tell you what we feel and discussions that I've had with the mayor at the meeting. One, we have to educate the community from the science. We know that that's going to be very important. We need to convey messages. You know, you do not convey to a 5-year-old what you might convey to someone who's 60. We've learned that the messaging and that might be at all this and trying to make. I've asked the business community experience that we had actors. that made it very difficult. And so they're willing to take upon themselves to make sure that they address within their own sectors the bad actors. We also know that we need trusting voices, and you know one of the greatest trusting voices that we have here is Mayor Leeser and what's happened in his own family and his commitment to this community. We need patriarchs and matriarchs to take it upon themselves to make sure that the families do everything possible not to have one more death or one more situation. We also know that that we have business leaders. For example, if I have a company that has 300 employees, I should take that responsibility to educate, to communicate, and make sure that that everyone is vaccinated. We have to work together. We know that we have to coexist, and that was a bad word at one time, coexist with a pandemic, because it was too new and we didn't think this was going to happen and we thought it was going to go away. So we have to do that. We now have the tools. And I'd like to remind everyone that what happens in El Paso is that the increases are exponential. We don't go from 600 to 650. We can go from 600 to 800. And so it's very important that sooner than later that we're able to address and make sure that we don't have that increase. We also know that that one of the great things that I've been seeing in our community are self-imposed restrictions, not mandates, but businesses that are not allowing too many people inside of their businesses, people making the curbside service, making sure that they on themselves begin to take this on. And we already know that that this curbside service has been extremely helpful. I think that we should continue doing that. Once again, you know, we're very supportive to our businesses. So if you do anything such as curbside versus going into, just help them out. Make sure that the businesses are successful as we go through this. We know something that was very important, and the learning lessons that we had is that first we had community spread, and then we had travel spread. And that travel spread is upon us now. Christmas is coming up. There's going to be a lot of individuals traveling, and we want to make sure that that doesn't happen as we go. We also know the staggering numbers. The mayor made reference to the staggering numbers of people not vaccinating, getting the virus, and also getting into the hospitals. And you can talk about 1 or 3 or 4 or 5 people that have been vaccinated and have the booster, but let's talk about the staggering numbers, like 77% at UMC are unvaccinated, are now in our hospital. You know, we know that before you were okay with one vaccine like Johnson & Johnson, you were okay with 2 vaccines. What the messages and everything the mayor and I have been hearing is no longer the basis of our success is going to be 3. Either the vaccine, if you have Johnson & Johnson and 1 more, or if you took Moderna or Pfizer, you need that and your booster. So here we have it, and here we are. And this is a call for action. We have the flu coming up. We haven't gotten all the numbers from Thanksgiving at this point. We have Christmas coming upon us. We have all these factors that are coming together, and we want to make sure that you remember we talked about the perfect storm that happened last November. I think I'm calling upon the community to make sure that we curb this situation quickly, because it can happen to us. Right now, we have our hospitals very saturated from non-COVID cases because of people getting the flu. And you know what? We did not have flu incidences. We had very minor flu incidents when we were wearing the mask. So it's very important that we don't get people into the hospital that don't need to be there. So once again, on behalf of the mayor and myself, we are calling the community to make sure that we do what we did before. We got rid of the mandates, we didn't use anything, we pleaded, and we asked our community, let's make this thing happen. We know we could do it, and let's all rally together, help the mayor and I make sure that January, we'll start 2022 in the note that we did last on January 21st. Thank you very much. Yes, sir.
Yeah, and again, you know, I'm sorry, the numbers that we just gave you all, that we talk about that were 72% fully vaccinated. You know, herd immunity really a lot of people that have had COVID-19 and recovered from COVID-19 has actually helped us, continue to protect our community. But, here's a number that I received from, let me get this here. The Texas Department of State and Health Service has released a study that shows unvaccinated individuals are 13 times more likely to test positive for COVID-19. So our job, we know that there's people that are not going to get the vaccine. We understand that. But our job is to protect them and protect everybody that gets a vaccine and has had COVID. So, we talk about 72% fully vaccinated, but again, people that have had COVID-19 has helped us even get that number higher to make sure that we have herd immunity and we protect all citizens of El Paso. So again, please get vaccinated. And and one thing that we didn't talk about, and I think it's important, the judge kind of touched on it a little bit, get the flu shot. It's really important that right now everybody goes out and gets a flu shot during the flu season. That talking to the CEOs of the hospitals, he's correct. The numbers are up of hospitalizations way over last year of people that had the flu because there's more people moving around, there's more people without a mask, and those numbers have really grown compared to last year. And with that, I'll open it up to any questions. Mr. Jackson?
Speaking with Dr. Opedanza yesterday, he said that roughly 1/3 of the new infections reported are among kids under 18 years old. Is there concern, come January when schools go back in session, when the kids are come back from the holidays, about adding to the fire, so to speak? Well,
we do know that schools are still in session today. And, all the school districts are governed by their board and the TEA. Our job as the county judge and the mayor of El Paso is to provide information, provide services, and make sure that if they need vaccine pop-up tents at any given school, that we do that. And we will continue to work with the school districts. The numbers you see today, they're open today. Now, when, we're still school in session. We will continue to work with the school districts. We'll continue to provide information, provide services. But it's important that you're right, that, as the school breaks, not only the young children, but the family members are very susceptible to the COVID-19 virus and everyone around. So, yeah, it's a big concern, but that's why we're here today, to ask them to really, we're not mandating anything. We don't ever want to mandate, but we do want to give you the information to make the right decision yourself.
And I have a follow-up to that. To successfully fight this, do we need to have a mandate, like a blanket mandate for the city and county?
What was that?
To successfully fight this pandemic, do we need to have a blanket mandate for the county, like, mandatory face coverings, for instance?
There's a lot of things that are mandated by emergency orders from the governor, and some of the things don't allow us to do some of the things we want to do. And we'd like to make sure that we don't mandate anything. We want to make sure that we don't get to the point where we have to mandate a mask in city and county facilities. Right now, we are looking at asking our citizens to be careful, know your surroundings, and make sure that you wear a mask. Every one of y'all is wearing a mask today. We're wearing a mask because you know what? It's known that if you wear a mask, you don't transmit the disease because it's it's an airborne disease and you're not doing that. So thank you for that. Next question.
Will you both tell us about statements in Spanish?
Yeah, I'm going to preguntar al juez que me pueda ayudar con eso. ¿Cómo lo ves en español? ¿Está bien así? No, yo lo puedo hacer en español, pero quiero que él me los hace y lo que no hace él, yo se los ayudo con eso.
Me va a permitir practicar mi español. Sí, es muy claro que están incrementando los números, que tenemos retos muy grandes, que estamos pasando por lo que sucedió en noviembre del año pasado. Y sabemos que con la vacuna, ahorita la mayoría de las personas en el hospital, como 77% en UMC, son personas que no se vacunaron. Sabemos que hemos aprendido mucho, pero sabemos que eso de los mandatos, de que todo lo que estamos tratando de hacer antes era porque no teníamos la vacuna. Sabemos que la solución es la vacuna La solución es hacer todo lo posible. Le estamos pidiendo, ayer tuve una junta muy importante con la comunidad de negocios para informarnos y ayudarnos unos al otro, porque lo que queremos es que la comunidad se proteja por sí mismo, sin mandatos, sin órdenes, pero que se protejan. Estamos aquí pidiéndoles, ¿verdad?, que todavía no nos llegan los números del Día de Gracia, todavía no nos llegan números de todo lo que está sucediendo y estamos entrando a una época que ha sido bastante vulnerable. Sabemos que somos vulnerables, una comunidad muy unida, que por un lado es algo muy bueno para nosotros, por el otro lado somos únicos y por eso tenemos retos y situaciones muy diferentes a otras comunidades. Tratar de compararnos con otras comunidades no va a ser la solución. La solución es que ambos, en Juárez, El Paso y Las Cruces, hagan todo lo posible para vernos como una región y hacer algo antes que incrementen estos números que pueden incrementar muy rápidos y no queremos. Queremos entrar al 2022 de una manera muy diferente a lo que nos pasó este año. Estamos pasando por mucho. Ayúdenles a los negocios y los negocios están dispuestos de protegerlos y esos negocios que no tienen interés en protegerlos, pues a lo mejor consideren ir a otro lado. Gracias.
Lo mismo que él dijo. No, les quiero dar unos números que son muy importantes, que tenemos que verlos juntos. Y déjame ponerlo aquí los números que estamos viendo, que la última vez que hablamos era el 11 de noviembre. Y el día 11 de noviembre teníamos 3,983 COVID cases. Y ahora tenemos 8,088. Y en el hospital teníamos 181, ahora tenemos 368. Y en el ICU teníamos 74, ahora tenemos 101. Y la cosa que es muy importante, que personas en el hospital que tenían COVID eran 9.71 hace un mes y ahora tenemos 18.28. Y le puedo dar por semana, el 11-11 éramos 971, 11-15, 11.19, 11-22, 13-28, 11-29, 17-12 y ahora, como le dije, estamos a 18-28. Y esos números son grandes, pero lo que estamos diciendo es que no estamos tan mal como estamos hace un año, pero queremos darles los números para que vean que necesitamos hacer la cosa bien, tener la máscara, para 6 pies de distancia y también limpiando las manos, para que nos hacemos donde estamos hace un año, que éramos el peor de todos los Estados Unidos, y donde estamos ahorita no es algo que está muy malo, pero no está donde estamos y no queremos regresar allá. La cosa que estamos hablando, que estamos aquí con los negocios y el puente está abierto y todos tienen que tener la carta toda llena de la vacuna, pero la cosa es que respiramos el mismo aire. Es una cosa muy importante que somos vecinos y trabajamos juntos. Gracias.
Gracias. Any other questions? Thank you, everybody, for coming.
I want to thank everyone for being here, but most of all, you have a safe, happy holiday season, and Happy New Year, and may God bless every one of you.